What is codependency? Codependency is a term used to describe a dysfunctional relationship pattern where one person prioritizes the needs and wants of another person over their own. The term was originally coined in the context of addiction, where family members or partners of addicts would enable the addictive behavior by supporting and protecting the addict. However, codependency can occur in any type of relationship, not just those involving addiction. Codependency can be difficult to recognize because it often masquerades as love and care. The codependent person may feel a strong sense of responsibility for the other person's well-being and may even believe that they are the only one who can help the other person. However, this sense of responsibility can lead to enabling behaviors, where the codependent person sacrifices their own needs and wants in order to meet the needs and wants of the other person. Some common signs of codependency include difficulty setting boundaries. Codependent people often have trouble saying no to others and may feel guilty or anxious when they do. They may also have trouble enforcing boundaries, which can lead to feeling resentful or overwhelmed. Difficulty expressing their own needs and wants. Codependent people may feel that their own needs and wants are less important than the needs and wants of others. They may also struggle to identify what they want and need in the first place. Low self-esteem. Codependent people may feel that they are not good enough and may seek validation and approval from others in order to feel better about themselves. Need for control. Codependent people may feel that they need to control the other person in order to keep them safe or prevent them from making mistakes. This can lead to controlling behaviors such as micromanaging or nagging. Enabling behaviors. Codependent people may enable the other person's problematic behavior by ignoring or minimizing it, or by making excuses for it. Putting others first. Codependent people may prioritize the needs and wants of others over their own, even to the point of neglecting their own needs. Codependency can have negative effects on both the codependent person and the other person in the relationship. The codependent person may experience anxiety, depression, and low self-esteem, and may have trouble forming healthy relationships with others. The other person in the relationship may become dependent on the codependent person and may not learn to take responsibility for their own needs and wants. Codependency often arises in families where there is addiction or other dysfunction. For example, a child may become codependent if they grow up in a family where one or both parents are alcoholics. The child may learn to prioritize the needs of the alcoholic parent over their own needs, and may become an enabler by making excuses for the parent's behavior or cleaning up after them. Codependency can also arise in romantic relationships. For example, one partner may become codependent if they feel responsible for the other partner's happiness and well-being. They may sacrifice their own needs and wants in order to please the other partner, and may become an enabler by ignoring or minimizing the other partner's problematic behavior. Treatment for codependency often involves therapy either individually or in a group setting. The goal of therapy is to help the codependent person develop a stronger sense of self and learn to set boundaries and express their own needs and wants. Therapy may also involve helping the codependent person to understand the roots of their codependency and to develop healthier coping mechanisms. In addition to therapy, there are several self-help strategies that can be useful for people who struggle with codependency. Learn to set boundaries. Codependent people often struggle with setting boundaries, but learning to say no and enforce boundaries is an important part of developing a healthier relationship with others. It can be helpful to practice saying no in low-stakes situations, such as declining a social invitation, in order to build confidence in setting boundaries. Practice self-care. Codependent people may be so focused on the needs and wants of others that they neglect their own self-care. It can be helpful to make time for activities that bring joy and relaxation, such as exercise, hobbies, or spending time with friends. Seek support. Talking to friends, family, or a therapist can provide much-needed support and validation for the codependent person. It can also be helpful to seek out support groups specifically for codependency, such as Codependents Anonymous. Challenge negative self-talk. Codependent people may have a negative self-image and engage in self-criticism. Challenging these negative thoughts and replacing them with positive self-talk can help improve self-esteem and confidence. Focus on personal growth. Codependent people may benefit from focusing on their own personal growth and development, such as pursuing education or career goals, in order to build a stronger sense of self and independence. In conclusion, codependency is a dysfunctional relationship pattern where one person prioritizes the needs and wants of another person over their own. It can arise in families with addiction or dysfunction, as well as in romantic relationships. Codependent people may struggle with setting boundaries, expressing their own needs and wants, and may have low self-esteem. Treatment for codependency often involves therapy and self-help strategies such as setting boundaries, practicing self-care, seeking support, challenging negative self-talk, and focusing on personal growth. With effort and support, it is possible to overcome codependency and develop healthier relationships with others.